afternoon, and thanks for joining us on Across the Fence. I'm Jolie Whitney. According to the American Heart Association, every 40 seconds, someone in the United States has a stroke, and every 3 minutes and 11 seconds, someone dies of a stroke. That's based on CDC data. While these are sobering statistics, there are lifestyle changes that you can take to lessen the risk of stroke. And there's an easy phrase to remember if you think someone is having a stroke that'll help you act to reduce the impact. To talk about this topic, I'm joined by Tracy Madsen. She's an associate professor of emergency medicine and the vice chair of research in the Department of Emergency Medicine at the Larner College of Medicine. A practicing physician and a researcher, she has expertise in acute cerebrovascular disease, stroke epidemiology and prevention, sex and gender-based medicine, women's health and disparities in the healthcare system. Welcome.
Hi, thank you for having me.
We're so happy to have you. I think everyone kind of understands what a stroke is, but can you walk us through what's going on in the brain and the body?
Sure. So what happens when you have a stroke is that there's a part of the brain that's not getting enough blood, nutrients, and oxygen. And that can happen for a few different reasons. Sometimes the blood vessel is blocked, and then sometimes there's bleeding into the brain. But ultimately, the effect is that there's part of the brain not getting enough oxygen, and then you have symptoms that result, like weakness on one side, numbness on one side, severe headaches, etc.
So is that essentially the same thing as a heart attack, but in the brain, or
Exactly.
similar enough?
And that's a great way to explain it to people. So when you have a heart attack, there's a part of the heart that's not getting enough oxygen because of a blocked blood vessel. Very similar with the stroke, it's just part of the brain instead of the heart.
And I just mentioned how frequent strokes are in the United States, but how many happen a year?
Sure, so we think it's just under 800,000 in the United States every year. It continues to be a leading cause of death and disability in our country, so is really of high importance.
Is there a high rate of undiagnosis that you guys know of?
That's a good question. I think more severe strokes typically do eventually get diagnosed because they have very dramatic symptoms, but certainly more minor strokes or things that strokes that are smaller or don't cause deficits that are as noticeable could go undiagnosed.
It sounds like there are two main types of strokes. Walk me through what those are.
Sure. So I kind of mentioned the types of stroke already. There are two types. One is ischemic, and that's the most common type of stroke. That accounts for about 87% of all strokes. That's when a blood vessel in the brain is blocked. It could be blocked because it's severely narrowed, because of kind of like a buildup in the arteries. And it can also be blocked because of a blood clot that travels, for example, from the heart to the brain. That's an ischemic stroke. And as I mentioned, when that blood vessel gets blocked, there's a portion of the brain that's not getting enough blood flow. The other type of stroke that accounts for about 13% of strokes is called a hemorrhagic stroke or a bleeding stroke. And that's when the blood vessel actually ruptures or tears a little bit, and then there's bleeding into that portion of the brain, again, leaving that area of the brain with a lack of blood flow.
And I mentioned that they're one of the leading causes of death and disability in the United States, and it's been like that for a couple years, but are they getting more common?
That's a great question, and we measure kind of how common a disease like stroke is in a couple of different ways. One of the ways that we can measure it is measuring how quickly new strokes are occurring, and that's something called incidence. The other way that we measure how common a disease happens is basically asking people, have you had a stroke? So we can distribute surveys and ask people whether or not they've had stroke. And so we look at it in both ways, and it's, I will say between the mid-90s, really like 2015 or so, luckily we were seeing strokes decrease. So the rate at which new strokes were occurring was decreasing, and that was pretty encouraging. Unfortunately, since then, we've seen kind of a stabilization of those rates, so they don't seem to be decreasing as quickly, and that's kind of in the overall population. It's also really important to look at specific subgroups of the population, so specifically younger people versus older people, men versus women, etc. And so one of the concerning findings we've seen come out in the last few years is that in younger adults, so people in their 30s, their 40s, their early 50s, strokes seem to be increasing. And that's a great concern because if you think about it, those are people that have many years of life left to live. They're working, they often have younger families. And so the effect of having a stroke on someone that's 50 or 45 is quite devastating. And so that's a group that we're looking specifically at to figure out why strokes are becoming more common in that age group in particular.
And can someone have multiple strokes over a lifetime?
Unfortunately, yes. So once you have a stroke, you're at a higher risk of having another stroke. It's one of the major risk factors for having a subsequent stroke is whether or not someone has had a stroke already. And that's really why we have to pay close attention to those that have already had strokes and come up with a really comprehensive, targeted plan to prevent future strokes based on the stroke that they already had.
So if someone's having a stroke, is that something that can be stopped?
Unfortunately, no. So once a blood vessel is blocked and part of the brain has already been depleted of oxygen and of nutrients, it's not reversible. We don't consider it reversible, but there are lots of newer medications and treatments that we think can reduce the impact of that stroke is happening in real time.
And you mentioned disabilities a couple times and those lasting impacts. What do those usually look like?
So it could be weakness on one side. Someone that came in walking and talking could leave the hospital not able to walk or talk or drive or work. So it really depends on the size of the stroke and the severity of the stroke. But unfortunately, we see many patients with long-term disabilities following stroke. And that's really speaks to the importance of studying this and figuring out how we can improve treatment and ultimately improve prevention to prevent the stroke in the first place.
And it sounds like intervening early on is really important. So how can you spot a stroke?
It is. So the B.E.F.A.S.T is the acronym that I like to teach people. So B stands for balance and eyes. So if you have sudden loss of balance, sudden loss of vision or sudden double vision, and then F.A.S.T is face, so facial droop. If you're sitting with your family member and all of a sudden you notice that your mom has a droop on the left side of her face, that's F. A is arm. So if you're with someone and you're suspecting a stroke, have them hold their arms out. If one side is drifting down compared to the other, that suggests that they have weakness on one side. Speech is sudden changes in speech. So all of a sudden someone can't find their words. All of a sudden someone might be slurring their words. Those are the speech changes we often look for. And then T is for time, and that's really, really important. So we know that stroke is a time-sensitive condition in the sense that there are things that we can do in those early hours to treat strokes. But if you don't come to the emergency department within those early hours, then you're often not able to get those treatments. And so we want you to come right away. Call 911, come right away.
And do strokes look different in men and women?
So that's a great question. I like to kind of compare strokes to heart attacks in this on this topic. So when someone has a stroke, when part of their brain is not getting enough oxygen, it usually it kind of manifests itself as weakness on one side, numbness on one side, loss of vision, facial droop, some of the things that I've just mentioned. And so we know that men and women both have those symptoms. So those symptoms are very similar. We should be looking for the same symptoms in men and women. The difference comes into play when we talk about associated symptoms. So women might tell the story a little differently. They might come in saying, yes, I have some weakness in my left hand, but I've been feeling pretty tired, maybe a little off, I'm pretty stressed this week. So they may describe some associated symptoms that can make the diagnosis more challenging, but really we need to focus on those cardinal symptoms that I mentioned, the weakness, the numbness, the headaches, the loss of vision, and act quickly.
And something I've heard you mention a couple times is that it'll impact one side of you. Is that something that you should make sure and look out for, a hallmark of a stroke?
Yes, and not to say that it can't affect both sides, because people can have multiple strokes at once, which is very scary, but often you see one-sided symptoms, and that's because it often affects one part of the brain at a time. So if you have a blood vessel going to the left side of the brain that's blocked, then the right side of your body is going to become weak. And so we often look for one-sided symptoms when you come to the emergency department.
And it sounds like you should really act very quick and be reactive, but does it matter maybe if I only have loss of vision but not weakness? Are you looking for all the symptoms or just one?
One symptom is enough. Call 911, come see us, because strokes can cause many different symptoms, and often they can only cause one of those symptoms. There are specific types of stroke even that can cause blocked arteries going to the retina, which is part of the eye that helps you see. And so even if someone has only loss of vision, we want to see you in the emergency department to diagnose a potential stroke.
And we've talked a lot about what to do if you think you're having a stroke or someone in your life does, but what can we do to prevent them?
Sure, so this is very important. And we think about prevention kind of in two buckets. Primary prevention, so that's for people who have never had a stroke but have stroke risk factors. And so we can do things like treat their blood pressure, advise healthy diet, physical activity, healthy weight, treating high cholesterol, etc. And those are all things we can do to prevent that first stroke. So it's really important to go to your doctor, ask about your risk factors for stroke. We can calculate even your risk for future stroke and figure out what medications, what lifestyle changes can we do to help you prevent that first stroke. And then the secondary prevention is when someone has already had a stroke. And so we're often quite aggressive in terms of treating risk factors to prevent that second stroke. And many of the risk factors between primary and secondary prevention overlap. But some of the treatment strategies might differ a little bit depending on what we think caused the initial stroke.
And you're an emergency room trained doctor, so how often do you see stroke cases coming into the emergency room, and what do you tell them?
So unfortunately, I see these all the time. Most shifts that I have in the emergency department, I see someone coming in with a stroke. And so it's really, again, the timing is important because I see the differences in patients that come in right away, and we can treat them with a clot busting medication or by actually removing the clot from the blood vessel. We have really great options for treatment. But if someone comes in after that initial time period, so if it's like 2 days later, et cetera, like if it's too late, if you come in after that initial after the initial symptoms start, often we can't give you the treatments that work better. And so it's really heartbreaking for me to see people coming in kind of delayed, and we have fewer options to give them for treatment.
And you touched on this a little bit earlier, but are there certain races or genders that are more prone to having a stroke?
Yeah, so unfortunately we know that there are major disparities in stroke, particularly with respect to race. So there's something called the stroke belt, which is an area of the southeastern United States. And we know that the proportion of Black adults is higher there than in other areas of the country. Stroke mortality rates are 30 to 40% higher in that area of the country. And we know that stroke risk is higher in Black and brown adults compared to white adults. So one example of a really important disparity. We also know that there are sex and gender differences in stroke risk between men and women. Those change across the life course because women have different periods in their life where stroke risk increases because of changes in hormone levels. For example, after menopause, we know that risk goes up in women. And so those are subgroups of the population that it's really important to pay attention to, particularly with respect to prevention.
All right, thank you so much for joining us today.
Thank you. Thanks for having me.
Of course, and to learn more about stroke prevention or any of the other stroke-related topics we've discussed today, you can visit the website on your screen or talk to your primary care provider. And that takes care of our show for today. My thanks to the crew behind the scenes here at WCIX. I'm Jolie Whitney. This is Across the Fence. Have a good one.